next item is the approval of the candidates for the HIV Health Services Planning Council. We have, I keep getting pop-ups. Hold on just a second. We have 3 candidates put forward: Phillips, Rhodes, and Willett. And they look extraordinarily qualified. And so I will ask the board to vote. Well, let me ask if are there any objections to just voting on all 3 at the same time? No. Okay, so I will put that forth. So could you please type into the chat if you approve their nomination? Let me just mark this HIV candidate. Okay, great, 1, 2, 3. I'm just checking on that. We have I'll wait until everybody's voted. Okay, wonderful. Terrific. So all 3 have been appointed, have been approved, and I'll pass that on to the HIV Council. Thank you very much for that. Next item, I want to just note that Dr. Damiano is on vacation, and as so characteristic of her, she has sent an update, a written update. So you should have received that in the packet. And it will also be posted on the PHAB website. So could you please send me any questions you have about that? I'm not going to go through it, but I hope you will. And if you have any questions, I will be meeting with Sandy later in the month. So please forward those to me. In the meantime, we do have a public health update. So Dr. Cassier so graciously is joined. I saw her on here somewhere.
I'm here.
Oh, good. You're a square somewhere.
Yeah.
So wonderful. Nice to have you. And we so appreciate the updates. So I'll hand it over to you.
Sure. Good. I think afternoon, everyone. Real quick. I think you're all aware by now that we are in a surge, and this is mainly being propelled by the Delta variant. We were doing well until the June 15th when the economy opened up. We started seeing a little bit of an increase in cases, but that was to be expected. But then we started seeing an acceleration of that increase to the point where we were seeing our case rate going up by 1 point every single day. And lately it was at, from the yesterday's report, it was at 26. It's at 25.6 today. So that's the first time in several weeks that we have actually seen it dip. Hopeful, but it's too early to tell whether we are seeing a peak. But at least this is the first time that it has not continuously gone up from one day to the next. We're averaging about 400 cases a day. So a lot of concern at the state level in terms of all the counties are seeing an increase, and again, being driven by the Delta and mainly among unvaccinated. For when you look at our cases, about 90% of the cases are among people that are not vaccinated. So it is still finding ways of spreading in those communities. When you look by geography, the high case rate as well as the low vaccination rates are still in underserved communities. So we've continued to work with community-based agencies to get the message out, to get people vaccinated. We have small pop-up clinics that we've been running. And lately the request for those pop-up clinics has picked up a little bit. So that's a good sign. And but one of the questions we've been asked by the media a lot is that are we concerned with the rate of vaccination? And what we're pointing out is we were fully aware that once the major interest in the vaccine waned off, that we would not see a lot of people going through our large throughput sites such as CalExpo. So we started as soon as we were able to get enough vaccine to plan for these small pop-up clinics. It's a lot of work because in many of the cases, we are having to have the vaccine ambassadors, as we call them, or the people from the CBOs actually go door to door to call people out and encourage them to come and get vaccinated. Also continuing with the public forum. Initially, we were having it twice a month, but after the economy opened up, we reduced that to once a month because we saw a drop off in the number of questions and people attending. But we still feel that it's useful enough for us to be able to continue having those. So credit to the PHAB, which is the one that actually started those public forums, but we've had a lot of good feedback because people are able to submit their questions and have us respond right there and then. On the policy side, there's been quite a flurry of activity. Initially, Sacramento County issued a strong recommendation for masking indoors, and then after CDPH and CDC changed their guidance to also recommend masking indoors, especially in areas seeing high transmission, we issued a health officer order, and that was following LA and Yolo County for masking indoors regardless of vaccination status. And I think yesterday, the Bay Area also issued orders. And then with healthcare settings, the state recently issued a mandate that healthcare settings have to do verification of vaccination and twice a week testing. And so there's many of them are still in the process of setting that up. My understanding is many of them are either have issued or in the process of actually issuing even stronger language of requiring vaccination for especially people that have direct patient care or contact. So we'll see that playing out over time. I think some of the private, the universities have also done that, especially for their students. They have UC and Sac State, I believe, have already stated that for students returning, they all had to be vaccinated. Those are the major things going on. So I don't know if there are any questions for me.
I do.
Yes.
How are you? That
Holding
wasn't a
up.
question, that was rhetorical. If 10% of the positive tests are people who have already been vaccinated, are we tracking which vaccination they have, what flavor, and whether they have gotten both shots?
It's a mixture, and when we are considering breakthrough cases, it's only for people that are fully vaccinated. So these are people who have either had one shot of the J&J or two of either Moderna or Pfizer. I cannot tell you what the breakdown is by vaccine, and I don't know how much information that will provide because Pfizer was the one that was used the most, and we've only had a small proportion of people that have received the Johnson & Johnson. So we would have to look at proportion by, the number of people that have that vaccine in order to make a fair assessment.
Dr. Kasiri, I have a quick question.
Yes.
Since so many of our Medi-Cal patients are being treated or followed by the geographic managed care programs, have they been aggressive in reaching their populations? And do you know how successful they've been in that goal?
We have been in communication with one of the health plans, and they have said that they've been putting out messages, have even supported some of the clinics. And of course, Kaiser also has been, upfront in providing vaccine as well as providing the messaging. So I think that they are doing as much as they can in getting the message out. We have requested that working with the health systems to be able to have the vaccine in their offices, especially pediatric offices, because we think that that will help with our vaccination, especially for the teens. Some of the systems have been more successful than others in being able to do that, but I think we're going to move towards having the vaccine available in clinics, because at least a physician has more ongoing contact with their patients and is able to convince some of those that are still hesitant.
Dr. Kasiri, I have a question about messaging.
Yes.
It seems like there's a lot of sort of hype in the media about, the breakthrough cases, almost like an over focus, and I'm wondering what your thoughts are on what opportunities are there, both in terms of reaching the hesitant, maybe addressing some things like side effects that may not be, or safety that may not, be at the forefront of the media. And then also for these breakthrough cases, is there an opportunity to message more about, the whole purpose of vaccines, which is to prevent severe illness, rather than, I find even the healthcare professionals seem to be focused way too much on, I don't want to get any infection, or, getting an infection is this terrible thing, versus like focusing on the important, public health impact of vaccines.
Yeah, it's been a challenge, and I think discussing and relaying probability and risk, relative risk, I think has been a challenge. I think there are two camps. There are those who, regardless of what you say, are looking for any excuse to say that they should not be vaccinated or that vaccine is a bad thing. And then there are those who I think have a difficult time with looking at, the medical field. We're accustomed to looking at it where, 90% is awesome for a vaccine, but you do understand that you will get some breakthroughs, and that is okay. But we've had some people emailing very angry saying, you told me to take this vaccine and now you're telling me I could still be at risk. And I'm like, well, it's a probability. And also the fact that for those who are vaccinated who do end up getting the infection, their infections tend to be a lot milder. And when you look at the hospitalizations, by far the majority are still people who are not vaccinated. The deaths we've had, I think we've had only 3 deaths among people that are vaccinated, and they tend to be older. So you can imagine that their immune system is weaker, and maybe they weren't able to get the maximum effect. But those are fine things that we are able to understand in the medical field, but I think it's been challenging being able to have that clear message. And when we're telling them, for example, I tried to explain that part of the reason why we're seeing more breakthrough infections is, one, the fact that if you have more virus circulating in the community in general, the risk for everybody does increase, including for those that are vaccinated. Because at the beginning, I think it was only maybe 2% of our cases were among vaccinated, but that has gone up with time. But it's a difficult message to get across. I think it's very helpful when we have additional people who are able to give the message. This morning, I heard the interview with Dr. Christian Sandrock from UC Davis, and I thought it was just excellent. And so having those opportunities for more people from the medical community just explaining, hey, this is what we mean by 90%, I think it's helpful. I think there's another question. Okay, Dr. Ashley.
Hi, thank you for the information. I had two questions. I work with CBS Health here in the Sacramento area. So I'm just kind of getting back into the stores, and I'm noticing that we're unable to meet the demand at our facilities. So I'm just curious as to, are there any partnerships with the local pharmacies here as to maybe providing information where you guys may be able to come in on a day and just give these vaccines if you are having these clinics? Because I would tell you personally, it would lighten our load, and because I'm turning patients away because I don't have the time to do it. We're doing appointment only at certain stores, and some stores are accepting walk-ins, but it hurts to turn people away when I know people are here trying to get the vaccine. And secondly, as far as the population that are getting or the breakthrough, is there any information stating if these people are immunocompromised at all? Is that the population that's actually getting the infection again, and were they properly exposed to the vaccine because they were immunocompromised? If there's any data on that.
So your first question about, we don't have the staffing to come and do vaccinations at the pharmacies, but we do take requests for pop-up clinics, and that information about where the clinics are. We're trying to put clinics everywhere to make it as convenient as possible for people to get vaccinated. So I think being able to offer them that option, they could go to My Turn, or they could go to the county website to find out about clinics, so that we can, we try to take care of those requests as well as we can, but it would be difficult for us to be able to come to the pharmacy. We can give you more vaccine if that's what you need, but I think from what you're saying, it seems more of a resource issue. But definitely there are a lot of clinics out there on any given day where they can go and get vaccinated. So I think being able to direct them to our website would be helpful. And then as far as for those that are getting the severe disease for the breakthrough cases, yes, I don't have any hard data, but from anecdotally, it does tend to be the older individuals. So I think expected that they tend to have compromised immune systems. So that might be a factor that's playing into it, but it's not exclusive, because we have seen younger people with breakthrough cases.
Yeah, I have noticed the extraordinary number of clinics available, which is wonderful. I commend the public health. You've been doing a great job, and I'm sorry there aren't more staff to get the vaccines into arms everywhere, but that's just impossible, I know. But the effort is amazing.
Yeah, but the clinics are there, and it's I don't think that access is that much of an issue as when we started.
Yeah. There's one question in the chat. I'll make this the last question, and I know Sandy's not here, but the question is there mask guidance in the jail, and how are we checking if masks are being offered?
Yes, there is a mask guidance in the jail. The state had that already, that certain settings had to continue with masking, and it did include the jails. it is, the onus is upon the people in administration at the jail to enforce it. I have not, I do check in with Sandy on a regular basis. I have not heard of it being an issue, but unless somebody has anything different to share about it, my assumption is that they are following the masking guidance.
Great. There was another comment in the chat by Victoria, who's one of our presenters, and she was just letting us know that that Sac City School District also is assisting with vaccination clinics in partnership with public health. And
yes, absolutely. It's been a great partnership with the schools. Mm-hmm.
That's terrific. That's really good to know. Okay, thank you so much. And
Thank you.
Hope you get some rest. On to our prime presentation today. We're very, very pleased to have a number of people come to help us understand the issue of mental health in the schools. And the topic, the title of the presentation is Sound Body, Sound Mind, Improving Student Mental Health Through School-Based Health Services. And I will turn this over to Bina Lefkowitz, who is a trustee with the Sacramento Area Congregations Together, as well as on the Board of Education for the Sac County. And I, in advance, thank all of the presenters and look forward to a wonderful presentation and an excellent discussion with all of you.
Thanks, Farla. Hello, everyone. Let me share my screen, and Danielle Prince from our group is actually going to kick us off. So let me see if I can get, we have a PowerPoint for you. Okay. Can you see that? Okay.
Yes.
Okay. I'm going to see if I can just, Danielle, do you want to start? And I'm going to try to get the full screen on without the sidebar here.
Okay, no problem.
If you do the down below, Bina, this little, move your cursor all the way to the, keep going to the right. One more, hit that. Oh, wait, you went too far.
Oh, hit this?
Yeah, that one.
Okay, thanks, Sherry. Okay.
All right. I guess I'll jump in. Good afternoon, everyone. My name is Danielle Prince, and I'm happy to be here today along with my colleagues to talk to you about school-based mental health. And I think you all have a copy of this presentation, or at least it's on the list of names is on the agenda as well. But I just wanted to let you know that this slide you can refer back to know who's speaking. Next slide. And so we're just a little bit about this collective that's here today. The Ad Hoc Mental Health Collaborative is a collection of elected school boards and community advocates who champion expanded school-based mental health services in our county. Next slide. So this slide really speaks to the needs for school-based mental health. Starting with just the overall fact that students who have social, emotional, and mental health challenges or experience trauma are less likely to do well in school as well as in life. Educational success and mental well-being have many long-term benefits, including increasing the chances of economic stability and earning a living wage, as well as healthier relationships and more civic engagement. So given these benefits of good emotional and mental health, it's a significant concern to see that many students are struggling with mental health, yet not receiving the treatment that they need. And so you can see on this slide, a series of significant issues that affect students nationwide, including the fact that rates of inpatient hospitalization for suicide and suicidal ideation are climbing. 50% of mental illness shows up by age 14,
and 75% by age 25. Suicide is the number two cause of death of young people. 60% of adolescents aged 12 to 17 experience a major depressive episode, but received no treatment. Youth who experience a major depressive episode were twice as likely to begin using alcohol or drugs. And there was a 31% increase in mental health related emergency department visits and a 39% increase in the average weekly number of emergency department visits for suspected suicide attempts from 2020. So there's been a dramatic increase, almost a third. And so what this need speaks to is that early identification and interventions around mental health can help stem these disproportionate numbers of mental health issues, and that also disproportionately affect Black and Brown and English language learner students. School-based mental health is not just a school issue. Every stakeholder in the community is responsible for supporting whole and healthy youth in their care. And so I think you can put two and two together, but school-based mental health offers a great opportunity to reach these youth who clearly have the need. So when the services are where they are, they're more likely to get the help they need early before their issues accelerate. And so next slide. And just to recap, school-based mental health removes access barriers, serves students where they are with adults that they trust. Earlier diagnosis and intervention leads to better outcomes, a reduced burden on county systems by intervening early to prevent poor academic, behavioral health, and life outcomes, and improved coordination. And so with that, I'm going to turn this over to my colleague, Victoria Flores.
Oops. I actually think we're going to take our student testimonials first, and then we'll have Victoria speak. Is that good?
Yeah.
Okay. So Madison, you're up.
Thank you, Bina. Hi, everyone. My name is Madison Lynn, and I am super excited to be here today. In addition to these positions on the screen, I am also an intern at Teachers for Healthy Kids under another guest speaker today, Helen Ross Dowden. As I have learned through my work at Teachers for Healthy Kids and my experience as a high school student who has lost a close friend to suicide, mental health has always been an issue in young people, regardless of the COVID-19 virus. However, the isolation from classmates and friends that the virus has brought to all young people demonstrates the mental health of students has never been more important. As well as quarantine and isolation, an overload of screen time has put many students in a more anxious state of mind, with all classes being completely online this year and young people constantly scrolling through social media to just pass time or find ways to connect with others. Many of us never would have thought being away from school would be so uncomfortable and difficult. But separation from the classroom, only being able to see our teachers through a screen, and learning completely virtually has proven many of us wrong. Though these impacts of COVID-19 have paved a windy and uncertain road for many young people, students returning to campuses this fall gives the perfect opportunity for schools to prioritize the mental health of their students. Youth groups focusing on the mental well-being of young people are essential in order for students to readjust to in-person learning this fall. For example, the Challenge Day organization I'm a part of provides peer group interaction that enables students to support and connect with one another in a safe, open setting with confidentiality rules. On Challenge Day leaders like myself are trained to give their peers the opportunity to safely express themselves as well as their emotions in small group settings. Students come from Challenge Day with a refreshing new outlook on their peers and the different personal issues others may be facing. In addition to more Challenge Day chapters this school year, an increased amount of wellness centers in schools will prove helpful to students when returning to campus. In the 2019 through 2020 school year, I created the first wellness center at Franklin High School that provided calming, creative activities, as well as a place for students to relax, eat lunch, and just recharge mentally. After the mental stress created by isolation during the COVID-19 virus, more wellness centers and schools will allow students to focus on their mental health while balancing the many tasks of their school day. Professional mental health outlets for school wellness centers, as well as increased funding and awareness towards youth mental health organizations such as Challenge Day, will provide the necessary mental health resources students need this coming school year. Thank you for having me, and thank you for your time today.
Thank you, Madison. Nice job. Next up, I think, is it Hemi from?
It's Bemi, but my full name is Oluwabemi Sokeshania, but it's Bemi. Thank you. Good afternoon. My name is Oluwabemi Sokeshania. I am an upcoming junior attending Vista del Lago High School, and I was a part of the Youth Leadership Academy with Pro Youth and Families. I strongly care about the mental health and well-being of youth because I know how much it impacts my generation. During my freshman year, I was in a very depressive episode due to some mental issues I was dealing with at the time. The hardest part for me, and I think it's the hardest part for many other students, is reaching out to somebody for help. I always felt as though people would judge me or have a negative response if I ever expressed that I was struggling with my mental health. With this being said, I would like for more school staff to make it known to their students how supportive they are of our overall mental wellness. In order to do so, additional training is needed to help educators identify when students may be going through a crisis and how to reach out and support those students. Mental health services and support are important in creating a better environment for students. Being in a state of distress makes it really hard to balance things like school because you're just thinking about like the distress you're in. And while services may be available, it doesn't mean that services are accessible and known to students. More outreach is needed. I enjoy and appreciate the online surveys my school makes us take regarding our mental health, but they aren't done frequently enough, and there isn't any follow-up in regards to the next steps. I'd like to see more data collection in our schools and county, and more follow-up that allows youth to provide input, insight, and take action to improve our mental wellness. Finally, I support the recommendation to provide education and training not only to teachers, but to students and parents on mental health literacy. I strongly believe that the increase in mental health literacy across the board will make it more likely for students to receive the care they need and break down the stigmas and stereotypes around mental health. Thank you for your time.
Thank you for your testimonial. Much appreciated. Wendy from Pro Youth and Families, I'm going to ask you if your third student has arrived yet.
She hasn't hopped on just yet. She's finishing up a club, but we'll hop on
Okay.
maybe a couple more minutes. But she can, when we're ready to have her, she can just speak. I'll let you know.
Okay, thank you. So I think what we'll do is, I believe that, current landscape. Okay, I believe I'm next, and then we'll put her in. If you would just let me know when she arrives, that'd be great. So I'm going to talk a little bit about the current landscape. And so my name is Bina Lefkowitz, and I am a trustee on the County Board of Education and an active member in Area Congregations Together. And so just to note that children are a large percentage of our Medi-Cal population, but a very small percentage of the funding is going to mental health services for students. Very complex, lots of reasons, but important to note. The second fact I want to note is that California ranks 41st in the nation for per pupil funding and for schools. Although it is getting better, we are the 5th largest economy in the world. And this metric is, I think, very shameful that we are almost at the bottom of per pupil spending in the nation. COVID has definitely put a spotlight on the need for the lack of student support services and equity gaps in education. And historically, not a lot of education money has gone to support mental health services for students. We believe there's not enough funding going to prevention services for youth. The focus has been pretty much on crisis care, which we understand, but we think being more upstream is very important. The systems are very complex. We have 13 school districts in this county, a county office of education and our county mental health department, plus a bunch of health plans. And so this makes it very challenging for families and for the systems to coordinate. Positive steps are being taken with children's system of care that the county has implemented. We have more social workers in our schools because of an initiative between the County Office of Education and the county, trying to get a social worker in every school. And I would say from what I've observed, the partnerships between the county mental health department and SCUSD and our schools, over the last 12 months, I've seen just a growing, very exciting set of partnerships develop. Next, I want to note that California ranks 43rd in the nation on schools' ability to recapture something called LEA BOP Medi-Cal. And this is for both health and mental health services. Sacramento schools are in the bottom 30% on the state in terms of schools recapturing these funds. This means that more money is being left on the table and there are fewer services for students. The good news is the county and the County Office of Ed are working with our schools to address the barriers that result in this low recapture of these federal funds. And in addition, there is new state funding that's also going to be supporting this shift to get more funds recaptured, and also changes in regs will also help in this regard. And with that, I'm going to ask Helen to take the next slide.
Hello, everyone. I'm Helen Roth-Dowden from Teachers for Healthy Kids. I've worked at the intersection between schools and health for over 20 years now. In my background's in public health, I have an MPH degree and have always found this work to be really exciting, but not as exciting as it's been this year, where the state budget contains more funding than I have ever seen for mental health services in the schools. And this is through a real effort of groups throughout the state and from Sacramento County to really pressure the legislature in light of the COVID emergency to do something about this. So you will see there's new state budget includes $4.4 billion over 5 years for school and mental health and county mental health programs. And I think there's a chart at the end of this presentation which sort of lays out the various, how this money is going to be spent. So I won't get into the specific amounts and where they're going. But there was also within California, we had applied for a state plan amendment that was approved 2 years ago, or I'm sorry, well, almost 2 years ago, and was implemented as of October 2020, that will expand services that can be given to schools through this LEA BOP, which provides a federal match to state funds that are used in the school for Medi-Cal eligible students. And it was only for kids who had individual education plans, special education, but this new state plan amendment now allows schools to bill for all kids on Medi-Cal, not just those with individual education plans or special education, increases services to include things like immunizations and nutrition services at the school, as well as new providers such as psychology interns and other classes of mental health providers. There's also funding in the budget for ACEs awareness and mental health education that we're hoping to put to good use in this county. And there's $400 million for health plans, and this is private health insurance as well as public Medi-Cal plans to partners with schools. And a lot of this is to build an infrastructure so that schools can bill for services for kids who have not been receiving, even though there's been a huge need, services within the school site. And I think that this will go a long way to making sure that there's sustainability of some of these new funds that are coming in, because many of them are backed by COVID funds that have been received from the federal government. So this is the way of our building sustainability. And then there's also money for workforce, behavioral health training and workforce. And Bina knows a lot more about this. I don't know if she wants to say anything, but we would love to see people like SETA be involved in this. Next slide. I'm sorry, I'm having trouble talking. Ina, can you help me with this?
Yeah, sure. So the Mental Health Services Oversight Committee is actually funding a county school partnerships, and I believe that our Sacramento County and SCUSD will be receiving maybe about $6 million of that funding coming soon to continue to build those partnerships. As I mentioned, SCUSD launched schools as centers of wellness, where the goal is a mental health worker in every school, and that was made possible because of a strong partnership with the county and some very creative thinking and discussion around how to fund such a program. Helen, do you want me to do the rest, or do you want to take it from here?
Okay, put myself off mute. I think you can talk about the student mental health plan, since you know a little bit more about that, and maybe I can catch up on the rest.
Okay. Another example of changes that will impact the system is the fact that SCUSD and the county are going to be updated a 10-year student mental health plan that expired, if you will, in 2019. And we're very excited that this update will really kind of set forth a new vision, new strategies, given all the changes that have occurred over the last decade and all the learning. So that planning will start probably in the fall, and our hope is to engage more families, and more community members in this plan.
Maybe I can talk about the new health authority. There was legislation from Dr. Pan that helped to create this, and Chet Hewitt from the Sierra Health Foundation has been involved. I'm sure as members of your committee know about this. But schools are hoping to have some input into this plan to ensure that health plans fully partner with school districts to provide mental health services at school sites for these kids. Even though 20% of kids need these services, we've seen in the past only about 5% are actually receiving the services. And that's the reason we need to strengthen these partnerships. The SAC board has also created a behavioral health advisory committee for youth, and we're thrilled because we think they, as you've heard from our wonderful speakers today, that they have something really to say around this, and we're thrilled that their voice is being included. The last thing is we've been working with SCUSD to ensure that our partners in the schools, those who staff people, actually understand how they can leverage these new funds and take advantage of them, both through the expansion of the state plan amendment for new services, and also to get us out of that bottom 30% that we're in and move Sacramento up in terms of taking advantage of current programs and also creating sustainability for these programs at the school site. So that's my part, and I'll turn it over to our next presenter.
Okay, so I'm going to just speak for a few minutes about some challenges given COVID, and then we'll have our last student present, and then we'll have our school district person, Victoria, present. So just real quick, access issues have always been access issues. You know, I think it's just become more obvious and more dire with COVID, the system fragmentation for a family, just trying to navigate between all the different systems that could impact their child, whether it's the school mental health supports, the county health services, county mental health, the health plans and providers. You know, we really think that navigators would be helpful to help families navigate between those systems. We have a lot of beautiful language and ethnic diversity in our community, but our service system does not really match what our community looks like. And there's definitely a need to increase pathways into the behavioral health field, increase the diversity in the field. There's some exciting work going on with our employment training agency, the county, our providers, and our community in our college systems to build more pathways so more diverse people will be interested and ready to go into the field. We have a very siloed system between our drug and alcohol and our mental health services. We know there's a nexus between those two issues. We've seen through COVID an increase in drug and alcohol use, certainly among adults. We think among children based on what we're hearing from some of our schools. There are very few school-based drug and alcohol prevention and intervention services, and there's not enough providers for referring kids who need those services. The other thing I want to mention is that although we're thrilled to have all this new state money, it comes with some challenges about figuring out how to strategically use it so that we can sustain the projects and programs and changes that are going to happen as a result of that funding. I think that's a good and a bad thing about the funding. Want to mention telehealth. We've seen the growing use of telehealth because of COVID, which we think is a good thing. I think the challenge now is to figure out how to integrate that more into an ongoing, regular part of the system. Schools, I think, are definitely have always known the need for early identification and intervention in our students. I think COVID has made that even more startling. And I'd say we're in the early development phase in our schools regarding that, with new models being developed, systems being developed, and certainly a need to invest in early identification and intervention. And the last thing I wanted to mention on this chart is there's young people tell us they want to speak to their peers before they speak to an adult and a counselor, a therapist. And so we have seen a growing interest and need for peer-to-peer programming. There are some new models emerging in the community. It's very exciting. There's limited funding, but we think that is an area of growth. And with that, I'm going to ask our last young person to give us their testimonial. And then I'll turn it over to Victoria after that. Wendy, could you help me with her name?
Yeah, so we have Idika that's also on the line. If you're ready, you can just go ahead and start talking.
Hi everyone, I'm Idika Kaudab, and I'm an incoming senior at Pleasant Grove High School in the EDUSD schooling system, and I was a part of the Summer at City Hall program with Pro Youth and Families. Mental health and wellness among youth is a growing concern, and more resources and strategies are needed to support youth into their transitions in adulthood. Within our diverse community, we know that everyone is dealing with something different. No one is ever dealing with the same thing. Many youth have gone through and may be currently going through adverse childhood experiences that contribute and influence their mental health. There is not enough screening and intervention provided to students and families. Students also go through extreme intense intruder drills, family issues, and academic pressures that all contribute to their anxiety. And they're going through all these things at a young age. It's never when they're growing up. The pandemic has added another layer of uncertainty of the future. And as they go through the motions of moving on from one grade level to the next and eventually become young adults, they experience even more things that take an even bigger toll on their mental health and physical health. Yet we students don't feel supported enough in our journey. Many youth don't know how to get help, and for the very few that do know, they don't feel safe trying to get the help, or they don't feel that they have enough resources that fit their needs or experiences, or they don't feel encouraged enough to reach out to get help. Many students go to schools that aren't necessarily equipped with many counselors, and if they are equipped, they're college and career counselors. They're not trained with mental health and wellness. And that needs to change. That's the big part that needs to change. Not many teachers also are knowledgeable or approachable about what to do with the student when they're having a mental crisis or a mental breakdown in class. Many students have test anxiety or social anxiety while also handling a ton of stressful work. And this is very hard to do in school and high school especially. All of these are already very hard for a student to experience, and having a teacher that doesn't really know how to handle the situation makes it even worse. I believe that there should be more mental health training for teachers so that they know how to handle different situations, and more mental wellness counselors in our schools that students can talk to, and more screenings and interventions provided to students and families. With the unknown and uncertainty about what going back to school in the fall looks like during the pandemic, youth will continue to face a lot of stress, anxiety, and pressure on them by their friends, family, and society. There needs to be tremendous support to help the youth successfully transition into adulthood with social and emotional skills and resilience. Thank you for your time.
Thank you very much. We really appreciate your time and your testimony. So now I'm going to turn it over to Victoria Flores from Director of Student Support Services with Sac City Unified School District.
Hi, everyone. Thank you for that lovely introduction, Bina. I'm a school social worker by training, so just wanted to sort of qualify myself. I also oversee our health services program as well as our school-based mental health. That's why I jumped in with the vaccine info. We are living that world and really living what all of our students talked about. I'm really trying to find all of the ways that we can reach and support in ways that are meaningful to our youth. So I hope that comes through today. And so we wanted to start out, many of you are probably very familiar with this model. It's a public health framework, right? But this is really, schools have really built their interventions on this model. It started as return to, response to intervention. I'm gonna get all my acronyms mixed up. And now you might hear things like multi-tiered systems of support, or MTSS. It's really just that tiered support of prevention, early intervention being our tier one. That's where most of our time and resources should go to, all the way up to then a tiered approach to supporting our youth, our families, and our communities, right? We live in systems. And so we just wanted you to hold that in your mind while we talk about some of the examples of how we do this at Sac City. And all of the districts provide these types of supports. This is just sort of specific to Sac City. It might look and feel a little bit different in each district, but most have these. So next slide, please. So for us, we had 29 school-based student support centers. These are formerly Healthy Starts. So they have school employed and school located mental health staff. Whether they're a student support center coordinator or a school social worker on campus, those are the people that staff and families and students can reach out to. And they provide a whole host of resources and interventions, ranging all the way from dental screenings to intensive mental health services. We also have a district-wide Connect Center because not all of our sites pre-COVID money had that kind of support. And so we wanted to make that available for all of our families and all of our schools. So we have about 45 staff that serve out at those 29 sites. But what you'll see here, and Bina and Helen talked about that workforce investment. We had 84 interns serving at those 29 sites just last year, serving in 3 different disciplines. So social work, counseling or mental health, school nursing as well. And they provided 33,000 hours. It's like equivalent to 22 FTE of staff. So this is really a way that Sac City has had a long history of investing in those next professionals, young people coming out of school, whether they're at the bachelor level or the graduate level, to really support our community, but also help train, that next level. For next year, with all of this COVID money that's coming in 21-22, we are actually ramping up to have school-based mental health supports at every single one of our sites. It's a really ambitious project. We're not sure we're going to totally get there in that next year because you actually have to have the workforce to hire, but we are going to do our best. We've already hired, I believe, 7 social workers, many who are bilingual, bicultural. That's a real focus for us as well. And so we wanted to spend a little time talking about how do we identify students in Sac City? And we heard from our students, there should really be no wrong door, but we should also be actively looking and noticing. And so one of the ways we can do this is through data. And schools are really good at collecting data on people, right? So we've got things like grades and attendance and behavior referrals. And so we've developed an early warning system. You'll see lots of different systems within schools that flag when a student is at risk or really having trouble in one of these areas. We can actually sort the data in many different ways. We can just look at behavior by a school site, by a grade, or behavior and attendance. That's typically what we look at in our student support centers. And then you layer on the academics. They typically all align. If you're not doing well in one, you're typically not doing well in others. Another way we are noticing is we are doing these quick pulse surveys. They're short, they're they're a little bit more frequently. I think, can't remember now who talked about that. Maybe it was Idika who talked about, wanting, or Bemi, for people to ask and have surveys. And so these are short, brief surveys, and we are building in the capacity for students to ask for help. The survey will also flag if a student indicates something that's concerning or writes something concerning so that we can follow up. We also developed an app. It was completely youth-led and youth-focused, and I'll share a little bit more about that. And then a referral. You can walk in, and a family member can walk in. Our best referrals are friends. I have this friend who, right? And that's how we'll kind of get connected with our students. So again, no wrong door for how we reach out and support. Next slide, please. And so here's a little data. This is actually from our 2021 annual report from last year. And I believe that Bina sent that to you all. It's a little dense, I apologize, but we did a lot, and we really wanted to share with our community how we're serving. And so we wanted to focus on the impact of COVID. So one of the first things we did is looked at what's our tier 1 that we can do. So we launched a virtual calming room that we had posted in every Google Classroom, and we got really positive feedback from our students on that, because it was they could access it in whatever way they wanted and were comfortable. And there were resources for crisis as well, and if you needed some more support. And then we really started working on building this GRACE app. Stands for Giving Resources and Care Every Day. And the students let us know, we don't necessarily want to come up and talk to you. This is our language, right? So if you see the picture over here on the left, there's actually a chat bot, and her name is Grace. That's how the app got its name. And this was the students' idea. They wanted to chat with a chat bot that felt comfortable. It actually gives students prompts that they can use to respond. So it gives them some choices, so they don't even necessarily have to come up with the words. They may, and it will lead them to a series of resources or urgent help. They can ask for help and get linked with a human if they'd like. And so we really are trying to learn our way. We're going to continue to develop this app out to support our students where they're at with what they are telling us they need. Some of the other ways that we looked at our data this year, we saw a lot of needs around basic needs support, housing, food, finance. That was major for us. Really big increase in some of our tier 2 and tier 3 supports, lots of families in crisis. You'll see that reflected a 62% increase in our crisis intervention. So when those different systems flagged students, that was when we responded. We also really focused on tier 1 supports. One of the standouts that we noticed that I realize isn't on this slide, but we saw a real significant decrease in our students accessing one-to-one mental health supports. Families and students did not want to do Zoom therapy as much as they usually did, right? As much as they would come in and see us one-to-one. Texting actually became incredibly helpful and popular. text for a 45-minute conversation, but I don't necessarily want to Zoom with you. That's okay. We will meet you where you're at. So that was really successful for us. And that's, you'll see reflected in that family outreach efforts of really being able to get a hold of our families. Don't always take the phone call, but they will text back with you. And we were able to get cell phones out to all of our support staff for that purpose. And then I think you all had some questions about suicide prevention and what schools are doing. So 16,000 of our secondary students last year did receive suicide prevention curriculum in their classrooms. We used an online platform called Cognito. It's basically almost like a video game, a choose your own adventure. And you are a character and you get to choose how you want to respond to a student who's in crisis. We also use signs of suicide. They're both evidence-based, listed in the SAMHSA. We had about 2,000 staff completed those, that training, the suicide prevention training. We also have an internet safety alert that lets us know when students write something concerning that we responded to, and provided about 300 suicide risk assessments last year. And then we do some mental health first aid trainings, question, persuade, refer. And we've got a lot more planned for next year because we know that the need is big. So, and with that, I am going to turn it over to Sherry.
So Sherry, we're almost out of time. So maybe if you could make a 1-minute summary, and then we could have maybe a few minutes for questions. Sorry.
No pressure, no pressure. Okay, let's see. You know, I am an instructor, so let's see if I can do this fast. So basically, my job was to bring it home and to recap everything that has been said succinctly. And so you can read about it and see. And I think what we really want, the point we really want to bring home is that mental health and public health, they're totally linked. So if students are having a mental health crisis, it's a public health crisis. And so you cannot separate the two. And so we just want to emphasize, you know, the need to continue to increase those partnerships, make them stronger, and increase the funding streams with the LEA billing, and ensuring that parents and students don't fall through the cracks because of fragmentation. You know, early intervention is always the key so that we can intervene sooner than later. And as Victoria just said, you know, we're old. Youth don't want to talk to us. So that youth voice, and we heard 3 beautiful ones today. So we need to really encourage and promote those programs. And diversity, you know, is the key, because not only do they not want to talk to, they want to talk to somebody who is in their generation and maybe their same age, but they also want to talk to, if it has to go to the next level, it's easier to talk to somebody who has that same lived experience. So someone who looks like you. And it's been said that, you know, students who are dealing with mental health, you know, and as a nurse practitioner, my patients will, you know, self-medicate. So, and we've seen, you know, they abuse substance like the adults. So to have those two linked, it would be very important. And here are some voices that will emphasize what I've just said within this last minute and a half. So you can read, and we want to, before, there's about 13 more slides, and these are for your reference and for resources. So we just wanted to let you know what those were for. So any questions?
I think, thank you all for this wonderful presentation. We don't have a lot of time, but I'm going to cut into a little bit of the rest of the agenda so we can ask a couple of questions succinctly and maybe get succinct answers if that's possible. But it is really wonderful to see all the funding that has come down the pipeline, at least for the short term. And I was so impressed by all of the programs, and you know, you seem so set to employ all this, that there are a lot of things, a lot of work that has gone on already. And so that, you know, with funding, it's kind of just boosting the efforts in all those areas, as well as hit the ground running for added efforts. So that's really marvelous. So Steve has a question. There's, I'm going to go through these. I have a question, and I think Sunal has a comment. But Steve, would you like to ask your question, or should I read it?
No, why don't you go ahead?
Okay. Even pre-COVID, there were increasing problems related to vaping and marijuana legalization. Substance use would be one manifestation of increased anxiety. How will the new mental health systems in the schools separate their services from traditional disciplinary actions regarding substance use?
Victoria, would you want to try to take that?
Sure, yeah, and I kind of jumped in the chat. So yes, like these are issues that schools have been dealing with for a long time. And our historical response was to suspend. Get caught with a joint, you get suspended, right? We're really trying to shift that to more restorative, that, hey, you get caught with a joint, you're going to get referred. Because we have programs for that, and we're going to see that as a cry for help and really take that more, trauma informed approach of like what's going on and getting curious about that behavior rather than punitive. We do not have school resource officers on our campuses anymore. That used to be a referral straight to an officer, and let's make that referral over to a social worker. We're fortunate enough, so are many of the big districts in our area, to have a 2P grant, the Tobacco Use Prevention Education, that actually funds this work. And so we have contracts with some of our local drug and alcohol intervention, agencies, and we'll make those referrals directly and provide support for the families as well. But there's a lot of work to do in this area. I don't want to make it sound like we have it all together. It's a long ways to go.
Thank you. I'd like to ask a couple of questions. Actually, I'm going to try and make them fast. The students, especially Bemi, was talking about asking the students, and that came through quite clearly. And I was glad to hear Victoria's comment about data. So I was encouraged because it sounds like you have a lot of programs. What the students are really wanting or, moving towards would be good to have that information so that you could focus more effort there. How well are they utilizing those services would be really good to have. And it sounds like you're heading that way. So that sounds very good. The one other component that I was curious about was mental health education for the teachers and the students. Are we teaching that? Is it, without giving it its due in the curriculum, it sends a message that this is not important enough to rise to the level of a subject. So is there a movement for that?
I think I can join in and someone else can add. So we've moved really far with social emotional learning curriculum. It's not quite far enough, I will say, but I think that's a good move. We're teaching mindfulness, so healthy coping, understanding our feelings. I would actually really love to see a health class come back. So this is me getting on my pedestal. A health class, which was an actual course that's like a graduation requirement, where we teach mental health literacy, substance abuse, right? That we actually teach, some brain science. And listen to our youth, honestly, and see what, it is that they would like. And we've been trying to make that push. I have not been successful.
Well, hopefully with Simone Biles and Naomi Osaka and all of the other emphasis on mental health, it would give impetus to move that forward with more priority, hopefully, because I think that's a message to the students that would help a lot. But
I just wanted to note the 10-year plan that we're going to be updating. I think that's a good vehicle for lifting up this issue and making it more visible and important for the schools and the county. The county already provides some funding to the County Office of Ed to train teachers, and a lot of school districts are doing some training of teachers around mental health first aid. But the teen mental health first aid curriculum that the state has promoted is just new and is just out. And people are starting to learn about how to train teens in mental health first aid.
Thank you. And thank you again to the students. They were incredibly wonderful and informative, articulate. It's great to see and great to hear their work in the area as well. And to everybody who presented, we so appreciated this wonderful presentation. So with that, I'm going to move on to our next agenda item. We're looking to hear from our working committee. We have a working committee in terms of correctional health. And Libby, would you like to give us a brief update?
Sure, happy to. So thanks everybody, those who are PHAB members and those who are visitors. To give a quick brief for those who are less familiar, PHAB has been hearing about issues related to correctional health over the last few months, starting in the beginning of the year. And we felt it was an area that merited further investigations. We've created a working committee that's going to look into jail health and particularly is concerned with questions of monitoring against the consent decree and whether those sort of mechanisms are adequate to monitoring the status of jail health services. So we've created a working committee. We can have up to 9 folks on that committee, 5 from PHAB and 4 from the community. We have 4 PHAB members, so wanted to put it out there that if anybody was interested in this topic and wanted to join the working committee, we'd be glad to have you. We are in the process of also reaching out to members of the community to try to get some participation from those who have lived experience with incarceration or personal connections to that experience or advocacy in that realm. So if you have any recommendations for folks that you think would be interested from the community, we'd also be very open to those. And the final call would be if there's anybody you think we should speak to. We're very much in sort of an information gathering, interviewing stage. So if there's anybody that you think we should speak to on this topic that's particularly informed or has an important perspective, please feel free to email me. I can put my email in the chat. And that's it from my side. Phil or Dr. Ashley, anything that you wanted to add?
I think that captures it perfectly, Lily. Thank you.
I agree.
Great.
Thank you.
And
so
thanks
much.
to Steve, who's an interim member for us while we're working on finding other members.
Thank you so much, and we look forward to a lot more information coming from the committee. I encourage you to participate if you have that interest. It's really very well organized, and I'm sure it will dig deep into this. I'm going to ask for public comments. We've had a lot of information come through this meeting, and we have some time for public comments on any issue. No, I hear none. Okay. Did anybody want to ask more questions of the presenters who have so graciously stayed on? Because we have some time and there was so much in those presentations. I know. Yeah, Steve. Yeah.
I guess this is part of public comment, but it really is a question to Bina and some of the others. There has been, as pointed out, a tremendous influx of new monies coming in. And I'm wondering if some of that will be going as seed money to further training programs. It's so important that we get mental health workers into the pipeline, because that's going to be a major issue down the road.
I can speak to that a little bit. The Office of Statewide Health Planning and Development, which is now run by Elizabeth Landsberg, is been tasked with spending or providing the programs for many of these dollars. And so a group of school groups is already going to start meeting with her, since they want to start a whole new sort of mental health profession in the school of counselors. And I think there's a meeting on the 17th on this. And there are other efforts that I would really encourage local communities to get involved. There's money that's also gone through for the first time, through the employment training panel within the labor agency. And this will allow local governments as well as private nonprofit hospitals to apply for additional funding for mental health training. And the governor also approved last year peer counselors now are able to get Medi-Cal reimbursement. So we really need to work on putting some of these efforts together. I believe, and Bina knows about that, there's already a grant that SETA has released and that Bina is part of to get our young people into these new mental health professions, to take them not only through community college, but our CSU, which has a really great program, into actually getting their qualifying for their master's and advanced graduate levels so they can practice and receive the reimbursement at that level. So I think we are really in this community stand at a really good place with our wonderful institutions we have here to move these kind of programs forward. I know I worked on this for many years, and I'm just thrilled that we seem to be putting all the puzzle pieces in place to provide this, since there's a 25% increase in health fund needed for people working in health between now and 2030. And that's just a huge increase in that part of the workforce. So we can sort of grow our own with taking students, particularly those disadvantaged students, and making sure they're part of this new workforce. Bina, are there other?
Yeah, the only thing I'd add is there is definitely an organized effort being led by the workforce board here, and the county is playing a big role, and the K-12, the community colleges and the college systems are all partnering together to create these pathways. One of the things we're looking at is an apprenticeship model where we could create behavioral health apprenticeships. There's a lot of money to do that. Los Rios Community College is on board to lead that work. So if that's the kind of training or education you're talking about, I feel like there's good momentum there. There appears to be lots of state money now available and federal money. If you're talking more about just training up teachers and parents on like mental health first aid, I believe there's more money coming in to do that. And I know Dr. Quist is on the line here. So I think that's, to me, that is more a capacity issue of getting, having time to train people like parents and teachers in mental health first aid.
And on the workforce section, I sit on the IACA, which is the new apprenticeship models task force for the Department of the Labor Agency for the state. And we have looked at mental health as being one of the areas where we want to do apprenticeships, since we have these 3,000 hour requirements in order to get your licensure, and it seems to be a perfect fit. A lot of these internships have not been paid. The other statistics that always amazes me is the #1 degree that students get from our CSU system is in psychology. So why is there such a lack of psychologists? And one of the things is you have to get these 3,000 hours without pay, and you can work in Starbucks, but other states like Washington State have very successful programs where counties and schools and private providers have provided the place, like our schools are doing, like Sac City is doing, to provide the places for these internships. And so we can move students of color who need this additional financial support through our apprenticeship program. And so that's what's really exciting, because we need to have a workforce, not only new workers, but those who reflect what California looks like.
Yeah, definitely. So we've come to the end of the meeting, but I'd like to address the PHAB board. I think that we have a lot of material here on which to build an advisory for the Board of Supervisors, including finding a plan for future funding to build on these funds that are going to start all these, allow all the implementation of these terrific ideas. But as we noted, there are limited funds in terms of timeline. And so that's one area, but there, as we've discussed, there are a number of aspects around this that we can include as advice to the Board of Supervisors. So I think I'll bring that to the board next month, and maybe we can draft some ideas in the meantime and send the letter off and support these efforts. So with that, I thank you all for your participation and hope to see you at the next meeting, most of you, and wish the students the best of luck because you're really on your way. You're obviously very well qualified for what you want to do. Thank you for coming again. We so appreciated it. Thank you all.
Thank you.
Thanks, everyone.
Bye.